Do you have a strong urge to urinate that doesn't seem to go away? Is your urine foul smelling?
Ew.
Or maybe you have pain in your pelvic area or a burning sensation when you urinate. This could mean that you have a urinary tract infection or a UTI. And in this video, we're going to discuss the lifestyle changes you can make, as well as over-the-counter medicines you can take to relieve your UTI symptoms, as well as one way that involves turning your urine orange or red. Stay tuned. Greetings, this is Brandon E, your Pharm.D, and welcome to my YouTube channel. When you think about UTIs, they're generally more common in women than men due to the differences of the male and female anatomy. They're caused by a bacteria and can include symptoms like blood in the urine, pain when you urinate, or urgency, or an overwhelming sense of needing to urinate or pee. So what are some lifestyle changes that we can make to prevent UTIs? Number one, you want to drink plenty of water. Doing so dilutes the urine and lowers the concentration of bacteria that are present in the bladder. Next, you want to urinate often and don't hold it. This discourages the growth of bacteria, which like warm and wet environments. Number three, you want to make sure you wipe from the front to the back after urinating or a bowel movement. This generally applies to women, as doing so can prevent bacteria from spreading from the anal area to the vagina or the tube that empties the bladder. Next, you want to empty your bladder after sex. Sex can cause bacteria to get close to the tube that empties the bladder, and urinating removes some of this bacteria before it can cause an infection. If you try some of these lifestyle changes and they work for you, or maybe you have some lifestyle changes to prevent UTIs that I haven't mentioned, let me know in the comments. And if you're enjoying the content, be sure to subscribe to the channel. So now let's talk about some over-the-counter products that we can take if we have a UTI. The first thing we're going to discuss are UTI at-home testing kits. And these are basically tests that you can take at home that will let you know if you have a UTI or not. They're similar to pregnancy tests, and they involve dipping a test strip into a sample of urine. And what they're testing for are nitrites or leukocytes. Nitrites are substances created in the urine when a large amount of bacteria are present, and then leukocytes are white blood cells, and white blood cells help our body fight infection. I generally don't recommend these at-home testing kits because if you do have a UTI, you need to be seen by your primary care provider, as you're going to need an antibiotic. An antibiotic is the only way to really treat or cure a UTI. And also your doctor is going to have access to more specialized tests that can tell them what type of bacteria are present in your urine and then which antibiotics will work best for treating that type of infection. Now, there are some instances where the at-home test may be helpful. I know in one instance during COVID, there was a patient that suspected they had a UTI and they couldn't get to the office for an office visit. So they took an at-home test, they sent the results to their doctor, and the doctor sent in an antibiotic for them, and they were able to have their infection treated. But again, generally speaking, I don't recommend using these tests. If you want to take the test and you're going to see the doctor and you just want to know for your own knowledge, then that's okay. So now the next product I'm going to talk about is called Cystex. And Cystex makes a lot of different products. The one I'm going to focus on is the pain relief formulation. This product has two ingredients, methanamine, which has antibacterial properties, and then sodium salicylate, which is a pain reliever. Now again, I just said if you have a UTI, you're going to need to see a doctor for antibiotics. So is this just okay to take and not go to the doctor? And again, the answer is no. While this does have an antibiotic, it's meant to prevent your UTI from getting worse until you can see the doctor, and it helps with the symptoms as well. So it's not recommended to take this product for more than 3 days. So again, if you do have a UTI, or let's say maybe you've had a UTI before, and you kind of have the same symptoms, you suspect you have one again, you can take this Cystex pain relief formulation until you can see your doctor, and the doctor can give you a better antibiotic. The next product we're going to talk about is called Azo. And like Cystex, Azo comes in a variety of different over-the-counter products. The one I'm going to focus on is the one with the active ingredient, phenazopyridine. And at the beginning of the video, we mentioned how turning your urine orange can lead to UTI treatment, and that was in relation to this product. As a side effect is it can turn your urine orange or red. Now, if this happens to you, don't freak out. I've had some patients take this product. Oh, my urine turned orange, my urine turned red. How long do I have to live? And I assure them, you're not gonna die. It's a normal side effect of the medicine. Don't worry. This product works in about 20 minutes and it helps with all the symptoms of a UTI, like urgency, burning, pain. And it's recommended to only take it for 2 days because, like the Cystex, it's just meant to help with the symptoms. It's not a treatment for the UTI. So let's say you've had a UTI before, or you're having some of the symptoms and you suspect you have one, and you're gonna make a doctor's appointment, but you want some immediate symptom relief, you can take this medicine for a couple of days until you can see the doctor to get that antibiotic. And so now let's put everything together. Let's say you have a UTI or you suspect you have a UTI. What should you do? Number one, you should make an appointment to see your doctor or some type of provider. Number two, if your symptoms are severe, you can take one of the over-the-counter products like Cystex, which will help with the symptoms and prevent your bacterial infection from getting worse, or you can take Azo. And then if you're having recurrent UTIs, you want to practice some of the lifestyle changes that we talked about to prevent you from getting them in the future, like drinking a lot of water, wiping yourself properly, those type of things. So I talked about drinking water in this video. Also have another video on constipation, and we talk about how water can help with that as well. So check that video out next. This is Brandon E, your Pharm.D. Remember to drink water. I hope this video helps.